Thanks, Taylor. In this morning's Woman's Doctor, we're talking about sciatica. It's a condition that can be agonizing. The sciatic nerve branches from the lower back and is the largest nerve in the body. It controls the muscles in the back of the knee and the lower leg. And joining us this morning with more is Mercy Medical Center Dr. Charles Edwards II. And Dr. Edwards, can you talk a little bit more about who is affected by sciatica?
Yes, good morning. Yeah, as people get older, our spines age, and as the spine ages, the discs begin to bulge and bone spurs form, and that can irritate people's nerves. So typically in people's 40s and 50s, they may begin to feel some sciatica symptoms.
And so what are those symptoms? I've heard that it can be debilitating pain down the leg.
It really can. It often starts with pain in your back, but then it becomes numbness and tingling going down your legs. Sometimes pain going all the way down to your foot. And it can be terrible, especially when you turn and twist in certain ways that cause pinching of the nerves.
And then it can make you not want to do things like you might do every day, like drive or walk. I imagine it can affect sleeping.
That's right. And unfortunately, with the pain, people tend to do less, they exercise less, they gain more weight, and that, of course, all aggravates the symptoms. So getting it treated is good to not only get the pain to go away, but to keep you on a healthy path of life.
All right, so talk about some of the treatment options.
Yeah, so if people feel some sciatica developing, then taking some Motrin or Advil is a good place to start. If it continues, then you should see your doctor, and probably a course of physical therapy would be the next step.
And what do you do in the physical therapy for that? Are there different ways to relieve the pressure on the nerve?
Yeah, our bodies are amazing, and over 80% of the time, these flare-ups of sciatica will calm down with some Motrin, with some time, with some exercise. But if they don't get better with stretching and strengthening and gentle cardio fitness, then that's when we would talk about a cortisone injection, an MRI, or maybe even a surgery.
Yeah, and I was just going to ask you about that. As far as diagnosing this, is there a one main test that you do, or is it sort of just listening to what the symptoms are from your patients?
Yeah, as somebody would see the doctor would make sure that this is not a hip issue or a circulatory problem, and an MRI can be helpful in confirming that this is coming from the spine, whether a bulging disc or a bone spur, those sorts of conditions.
And how long can this take to recover from? Let's say you do all the right things and you go ahead and do all the physical therapy.
You're right. It can sometimes be frustratingly slow. It can take several weeks for this to calm down. And so I tell folks to give it some time, be patient. But if after a month, if it's not getting better, then you should come on in and get checked out to make sure that there's nothing else more serious going on.
All right, Dr. Edwards, thanks so much for joining us this morning. Really appreciate it.
You're very welcome. Good day.
You too. And if you have any other questions or you'd like a referral, just call 1-800-MD-MERCY. Stay with us.